Alright, so heat stroke is very common nowadays, no? It is the most serious heat-related disease or illness. So it usually occurs when the body is unable to control its temperature. So when the body temperature rises up to 40 degrees Celsius, so we can say that the patient is having heat stroke already, no? So the 40 degrees Celsius should be continuous for at least 10 to 15 minutes, no, for we to be able to say that the patient has heat stroke. So usually the signs and symptoms of heat strokes are usually headache, nausea, dizziness, weakness, irritability, thirst. The body is unable to do sweating, no, because there's failure already with the temperature regulation of the body. That's very important in heat stroke, no? Hindi na makapagpawis yung pasyente, no? The pawis nasa loob lang, no? Hindi nakakalabas. Okay, so that's heat stroke. The risk factors, no, for the development of heat strokes are as follows. So number one, age. So remember, as we age, no, our body's mechanism tends to not as function as we are young, no. So heat stroke is very commonly observed in elderlies. Okay, so next one. So usually it is seen in patients who are in hot weather conditions, no. So for example, yung mga patients na nagte-training, no, under the heat, no, o kaya naman in schools when students do their physical education activities under the sun. So also sudden exposure to heat, no, pag nag-commute yung mga Pilipino, hindi well ventilated yung bahay nila, no. So yan, yung mga common causes of heat stroke. Heat stroke is the most serious of the three. So the second is heat exhaustion. So heat exhaustion, so usually that occurs when there's an excessive loss of water and salt in the body through excessive sweating, no? It's important to remember that heat exhaustion, meron pang sweating. Sa heat stroke, hindi na nagsisweat yung pasyente. So heat cramps usually occurs, no, kapag again exposed si individual sa excessive heat or meron siyang ginagawa na strenuous activity. So this usually depletes the electrolyte of the patient not to the level leading to heat exhaustion, no? Kaya nagkakaroon ng cramps si pasyente. So usually in heat cramps, there's loss of water and electrolyte, salt in the body, but not enough to lead to exhaustion. This is the easiest thing to do, no, especially in the weather nowadays, is to wear loose-fitting clothes and lightweight clothing, no. When you go out, no, it's important to always bring water and then drink plenty of fluids. Better if you're planning to go out, so do not go out na lang during the tanghali, no. Don't go out sa tanghali, no. It's preferably you go out sa umaga o kaya sa hapon paggabi na, no, to prevent excessive heat, okay? And then for example, no, nagji-gym yung pasyente natin, nagji-gym yung individual, okay? So wag agad sabak ng sabak, no. Parang dahan-dahan lang muna hanggang sa masanay yung katawan mo sa temperature. Di ba pag nag-exercise tayo, umiinit yung katawan natin. So it's very important to get acclimated, no, para hindi agad ma-expose yung katawan ng pasyente sa init. And also knowledge talaga, no, education, no, health education is very important. So individuals should know the risk factors for having heat stroke and then do any means, no, to prevent them, especially with the weather nowadays sa Philippines na summer. It's important to seek medical attention already. So tawag agad tayo ng ambulance, no? And then bring the patient to the nearest hospital. Now in case na naitawag na natin si pasyente para magpadala ng ambulansya yung hospital and madala siya sa nearest hospital, habang nag-aantay tayo, so it's important that we place our patient in shade or indoors or anywhere na malamig, no? Ilagay natin doon yung pasyente. And then kapag makapal masyado yung damit ni pasyente, open natin yung mga buttons, especially here, no? And kapag maraming layer layers, remove the layers until isa lang yung maiwan para presko si pasyente. And then, if possible, no, cool the person with whatever means available. For example, kung meron malapit na yelo, no, ilagay natin kay pasyente, no, parang punas-punas natin kay pasyente, sponge with cool water, o kaya kung meron kang water na nasa spray, pwede mo siyang spray para lang ma-preskohan si pasyente. No? Especially when we perform sponge bath, kung pinupunasan natin si pasyente, important na punasan natin yung singit and also yung kilikili and also yung leeg ni pasyente. No? Kasi yun yung pinaka-areas ng katawan natin na mainit during times of heat stroke. It's important to seek medical attention already. So tawag agad tayo ng ambulance, no? And then bring the patient to the nearest hospital. Now in case na naitawag na natin si pasyente para magpadala ng ambulansya yung hospital and madala siya sa nearest hospital, habang nag-aantay tayo, so it's important that we place our patient in shade or indoors or anywhere na malamig, no? Ilagay natin doon yung pasyente. And then kapag makapal masyado yung damit ni pasyente, open natin yung mga buttons, especially here, no? And kapag maraming layers, remove the layers until isa lang yung maiwan para presko si pasyente. And then, if possible, no, cool the person with whatever means available. For example, kung meron malapit na yelo, no, ilagay natin kay pasyente, no, parang punas-punas natin kay pasyente, sponge with cool water, o kaya kung meron kang water na nasa spray, pwede mo siyang spray para lang ma-preskohan si pasyente. No? Especially when we perform sponge bath, kung pinupunasan natin si pasyente, important na punasan natin yung singit and also yung kilikili and also yung leeg ni pasyente. No? Kasi yun yung pinaka-areas ng katawan natin na mainit during times of heat stroke.